My name is Matthew Lee Bush, and I go by Matt, and I'm an associate professor in the Department of Otolaryngology, Head and Neck Surgery here at the University of Kentucky. And in layman's terms, that long name is ENT, or ear, nose, and throat. And within the ENT realm, my primary area of interest is the ear. I'm involved in taking care of patients with a variety of different conditions that affect hearing and balance. That may be related to infections or tumors or congenital conditions that may affect hearing and balance. So hearing is a critical sense that we many times take for granted. We take it for granted until it's gone. In the situation, for example, of a child that is born with hearing loss, we learn to speak based on what we hear. And so if there's no input in, there's no output out. And so the thoughts of living your life, or as a parent, maybe living your life without your child saying, I love you, or I do, or some of those really important things in vocalization that come from speech and language development, it's really all dependent upon the input that's coming in those very early years. And so the effect that hearing loss has on a child is immense, and it's lifelong. So it makes it really a critical thing to identify in a timely manner and intervene in an appropriate way when we're dealing with pediatric hearing loss. Now, as it relates to adult hearing loss, that's incredibly common. Sometimes we may consider it being a disease of old age, or it's a natural process, but in reality, hearing loss affects people across the whole span of life. The effect on one's life and lifestyle could be immense. And it's important to know and to educate patients that we can identify and assess the hearing loss that they have and determine the degree of hearing loss and provide sometimes very reasonable and even life-changing treatments to improve their hearing and thereby their quality of life. Well, everything about my life and my career really revolves around patients. And my wife and my children also realize that, sometimes I take phone calls, I answer emails when we're on vacation and personal time, because these patients are an integral part of who I am and how I think as a human being and how I function in society. And it's important for patients to know that I take a very personal approach to understanding who they are, not only what disease they may suffer from or condition that they're dealing with, but how that condition affects their life. That's what's really critical to me. And then to know that I can be an advocate for them, trying to establish that relationship and then assuring them that I'm going to be with them as we walk forward in a journey towards hearing rehabilitation.